Welcome to Wisdom Radio. I'm Dr. Rusty Hoffman, professor of interventional radiology at Stanford, bringing you a direct line to critical research and interventional updates. Powered by AI, curated by experts. Let's get started.
Today, we're going beyond just, knowing the names of all the instruments.
Right.
We're diving into the subtle stuff, the little organizational tricks, the expert grip.
I mean, every procedural mistake, you can almost always trace it back to a breakdown in setup, usually a disorganized back table. We're going to distill the core rules for efficiency, for safety, and for sterility.
Okay, so let's start with what has to be the highest stakes rule, getting rid of air bubbles.
Bubbles, yeah. The golden rule is simple. You never hand over a syringe or tubing with air in it.
Because injecting air can be
Catastrophic. It's just that simple.
So what are the expert moves for managing them? How do you get them out?
Well, there are three main techniques. First, you've got inversion. You just flip the syringe so the air naturally floats to the tip.
Okay, that's the easy one.
Then there's the flick, to knock any bubbles loose that are stuck to the wall of the syringe. But the real trick is for those stubborn, scattered micro bubbles.
Yeah, the ones that seem impossible to get out. What do you do then?
That's when you use the push-pull. You briefly cap the top and pull the plunger down. It creates a vacuum.
And that forces them all to come together.
Exactly. They coalesce into one single column of air that you can just eject easily. And remember, and this is a critical warning, when you inject, always hold the syringe with the tip down.
Why is that so important?
If the tip is pointed up, the air, which always floats, is the first thing to enter the patient.
Wow. Okay, let's talk about grip.
Yeah, how you hold things.
For instruments that need fine motor control, like a scalpel or Adson forceps, you hold them like a pencil, right?
Just like a pencil. And if those forceps have teeth, be gentle. Squeezing too hard will macerate the skin. Basically, you'll crush it.
But the real expert versus novice distinction is how you handle clamps, like Kelly's.
Oh, this is the big one. This is the giveaway. A novice will always thread their fingers through the loops.
It seems like the natural thing to do.
It does. But experts deliberately avoid that. They palm the instrument, resting the whole thing in their hand.
But why? What's the advantage of overriding that instinct?
It's pure mechanical advantage. Palming it lets you use your thenar eminence.
That fleshy pad at the base of your thumb.
Exactly. You use that muscle to unlock the ratchet. That one small move gives you instant 360-degree rotation.
Which you absolutely need for suturing efficiently without having to contort your wrist into some weird position.
It's the lazy expert's way to be fast and precise.
That idea of physical efficiency must extend to the back table layout too.
It has to. You want to reduce your cognitive load as much as possible. So, two main rules. First, sharps needles, scalpels, scissors. They must always be in the top left corner.
Even if they're shielded.
Even if they're shielded. You know exactly where the danger is without thinking. Second, keep the table dry. A wet rag gets thrown out immediately. A damp table compromises sterility, period.
So with that foundation set, we get to maybe the most frustrating part. Handling those slippery hydrophilic wires.
Yes. They are notoriously difficult. I see novices drop them constantly. But there are three critical rules.
Okay, let's hear them.
1, always hold the wire with your palms down. 2, you pinch the wire with your fingernails, not the pads of your fingers. You get so much more purchase.
Fingernails, not finger pads.
Got it.
And 3.
Keep it wet. A dry hydrophilic wire stops being slick and becomes dangerously sticky.
And what about that specialized J-tip trick for straightening a curved wire?
It's a brilliant little move. When you need to load that wire, you pinch it just behind the curve, then you use the fingernail on your thumb to pull back and
It just straightens it right out.
it slides right in, no problem. If you connect all of this together, mastery in this domain isn't about memorizing steps. It's about building these highly practiced, standardized physical habits to minimize cognitive load and just prevent errors.
It frees up your brain to focus on the big picture.
Exactly, the high-level decisions.
That's all for today. Thanks for listening.
This is Dr. Rusty Hoffman, and that's a wrap for Wisdom Radio. Download the Wisdom app by searching for Medical Wisdom, spelled WYSDOM, or visit medicalwisdom.ai for rapid-fire videos, podcasts, and community insights. And remember, knowledge is the best medicine.